today's video, we're going to be talking about the cardiac conduction system. In particular, it's going to be an introduction to ECGs. So in order to understand ECGs, we first need to know about the conduction system of the heart, which is how the heart pumps blood around our body. So it begins with an electrical impulse being sent from the sinoatrial node, which stimulates the atria to contract. This is then picked up by the atrioventricular node, where there's a delay before it's passed down the bundle of His, the bundle branches, and finally the Purkinje fibers, which stimulate the ventricles to contract. So keep this in mind, keep this pathway in mind, because it will help you understand ECGs. So how do we test this conduction system? That's where ECGs come in, known as electrocardiograms or electrocardiography. Electrocardiography basically picks up this electrical activity of the path of the heart, and you can see it as a graph of voltage against time. So how is an ECG trace formed? An ECG trace is formed by placing 10 different leads in different places of the body which detect electrical activity. It measures it going from the negative pole to the positive pole. So there's 4 limb leads and 6 chest leads. The 4 limb leads I remember with the mnemonic ride your green bike, where ride stands for red in your right arm, your stands for yellow in your left arm, green stands for green in your left foot, and black and bike stands for black in your right foot. And you just remember it as a clockwise direction, and that's how you know where to place your limb leads. For your chest leads, V1 and V2 are placed in the 4th intercostal space, either side of the sternum. V4 is placed in the mid-clavicular line, in the 5th intercostal space. V3 is placed in the middle of V2 and V4. V5 is placed in the left anterior axillary line. And finally, V6 is placed in the mid-axillary line, so just below your armpit in the 5th intercostal space, or just below it. So these 10 leads are placed, and in turn they read 12 leads. So like I said, it goes from the negative to the positive pole. So you've got lead 1 and lead 2 and lead 3, which are drawn there. You also have 3 augmented unipolar leads, because they don't read from one lead to another. They just detect electrical activity in the directions that I've drawn in the dotted lines. And then obviously you've got leads V1 to V6, which detect electrical activity going towards them. So electrical activity travelling towards the lead is detected as a positive deflection, so it goes up. If there's an electrical impulse that's travelling in the opposite direction to the lead, then it's transmitted as a negative deflection, and so it goes down in the ECG. So let's look at lead 2 as an example. Why do we look at lead 2? Well, if you remember where the heart is placed, and if you remember the general activity, electrical activity of the heart, it's going in towards downwards and towards the right, and that's what lead 2 is looking at. It's looking at that view as well, and that's why it's a really good lead to look at. So what do each of the waves mean in an ECG? So this is an example of a normal ECG. You've got a P wave, a QRS complex, and a T wave. The P wave represents atrial contraction, the QRS complex represents ventricular contraction, and the T wave represents ventricular relaxation. Again, remember that leads detect electrical activity towards them as a positive deflection, and that's why in lead 2 all the peaks are positive. The QRS complex is much bigger than the P wave, because the QRS complex is about the ventricles, and the ventricles have more muscle mass, so obviously it's going to give you a larger deflection. So in order to understand the different views of the heart that each lead has, you just need to remember where the leads are placed and remember what the leads are actually measuring. So that's quite self-explanatory for the chest leads, because they're measuring activity towards them. And as long as you remember where the chest leads are and what direction they're measuring the activity in, the rest of it makes sense. So like I said, the chest leads are quite self-explanatory. They measure the activity that's travelling towards them. Lead 1 measures activity from the left to the right, and lead 2 and lead 3 are as drawn, and the same with the augmented unipolar leads. So different groups of leads will have different views of the heart. So AVR is actually the opposite direction to lead 2, which is why the QRS complex is the opposite way in AVR, because it's travelling the opposite way to lead 2. So leads that get an anterior view of the heart are V3 and V4. Leads that get a septal view of the heart are V1 and V2. Leads that get a lateral view are leads 1, AVL, V5 and V6. And leads that get an inferior view are lead 2, 3 and AVF. You can go back and pause the video to help you understand what views you get of the heart. So ECGs are helpful because they help you detect problems and tell you where the problem is, both in terms of maybe what artery or even which part of the conduction system. Thank you so much for watching, and there's definitely more to learn with ECGs, so stay tuned.